Last month, the Ministry of Health and Wellness rolled out the Barbados School Nutrition Policy, aimed at creating a healthy school environment to enhance student learning, but more importantly, to develop lifelong eating and activity behaviors to reduce the burden of non-communicable diseases in Barbados. In this episode of In the Know, Chief Education Officer Dr. Ramona Archer Bradshaw emphasizes the importance of the policy, explains the true consequence of children not adhering to the guidelines, and shares some cost-effective alternative snacks and drinks. All this and more on this episode of In the Know. Dr. Archer Bradshaw, thank you for making the time.
My pleasure, Krystal.
We're almost a month into the rollout of the National School Nutrition Policy, and before we get into the response and the pushback, I want to start at the very beginning. What is the National School Nutrition Policy and why is it important?
The National School Nutrition Policy was developed by the Ministry of Health and Wellness with the assistance of PAHO and with the support of the Ministry of Education and a number of other stakeholders, for example, the Heart and Stroke Foundation. And this policy seeks to enhance the school food environment because we recognize that when it comes to non-communicable diseases, especially in the younger population, that these diseases are wreaking havoc. It was time for the Ministry of Health and Wellness and the Ministry of Education to take a stance, and we did so by implementing the said policy in April, that is the start of term 3. It is important because in order for our students to perform at their optimum level, we have to focus on their health and wellness. We can speak about enhancing student outcomes. We can speak about wanting our children to carry Barbados, but can they do that if they are not physically well? So we have to place focus on what they eat and their physical activity. And that is what the school nutrition policy is about. Providing healthier options within the school environment and providing an opportunity for them to be physically active.
You spoke about NCDs wreaking havoc in our younger generation. What evidence is there to support that?
The Ministry of Health and Wellness has presented quite a lot of evidence on the number of children with non-communicable diseases, the number of children who are either overweight or obese. Research has been done to show that 1 in every 3 children is overweight or obese. And they have also shared with us that the number of incidences of non-communicable diseases in the young population has increased over the years.
Now, perhaps one of the primary questions asked has been around policing. How is it being policed and who is responsible for policing these new regulations?
Well, even before we implemented the policy, we had a number of stakeholder meetings. We met with parents, we met with principals, we met with teachers, we met with a number of groups. The reason for doing this is due to the fact that we wanted persons to understand the importance of such a policy. We wanted persons to understand the effect or the impact that not taking action, the actions that we are taking now, not taking those actions can have on our students as they progress in life. And we've done so, and I believe that we were able to convince persons that this is the time for change. Even the canteen concessionaires and vendors agree that this is the time for change. Now, in terms of the policing, we have principals monitoring, we have teachers monitoring, our education officers will go in, and they have been going in to monitor how things are going in terms of the implementation of the policy. The Heart and Stroke Foundation has also gifted us with a monitoring app. but we are not about to roll that out as yet because we are trying to finalize the logistics of rolling that out. For us at the Ministry of Education, it's about moral suasion. It isn't about penalties, telling persons, well, if you have this kind of food at school, we're going to take it away, so it means that you can't eat at all. No, we're not about that. We're about encouraging the children to choose healthier options. If we realize that they are eating unhealthily regularly, we'll make contact with the parents, ask the parents, if they're aware of the policy and find out what challenges they're having, and provide the support where necessary so that children can do what they're supposed to do in school, so that we can have that healthy school environment.
With no consequences or enforcement mechanisms at play, do you see moral suasion being effective?
Yes, it can be effective. I know that the Ministry of Education, Technological and Vocational Training has implemented Water Wednesdays and Fruit Fridays at schools. And this has been quite effective. The children actually remind their parents that a particular day is Water Wednesday. They can only drink water during that day, or a particular day is, Fruit Friday. They can only bring to school fruit on that day. The children actually put pressure on their parents to eat healthily. I see the same kind of response with the implementation of this policy. In fact, the student councils are very much on board. Students are more powerful than we think they are, and they're the ones who the change is for, and they're bringing about the change that is necessary.
We've spoken about children and teachers, but vendors, concessionaires also have to be factored in. I know you've met with a number of them, many of whom complained about incurring financial loss since the implementation of the policy. What is being done to ensure that they too can ply their trade within the lines of this new policy?
Well, during the meeting with the Canteen, concessionaires and vendors, there were some misconceptions about the kinds of drinks and snacks that they could sell. I found the meeting was very useful. The last meeting that we had was very useful because it allowed them to ask questions and get the answers that they needed. We had the support of the Heart and Stroke Foundation, the National Nutrition Center, and we were able to share with them the Gmail account, the alternative drinks and snacks at gmail.com. We were also able to point them to our website, the mes.gov.bb website, where they could find more information on these alternative snacks and drinks. There was also the question asked about distributors and whether we could get the distributors on board. And at that meeting, we had Mr. Brian Payne, who works with the National Nutrition Center under the Ministry of Health and Wellness. And he was able to share that we are seeking to have a meeting with the distributors so that they can bring in these healthier options to make it easier for the vendors. It is so important for us to have these regular meetings with the canteen concessionaires and vendors because they could tell us firsthand what they're experiencing and we could problem solve together. And that's why at the meeting I was exceedingly pleased about the fact that they formed a community of concessionaires and vendors who could represent at our high level meetings. I was very pleased about that. And that was an outcome from the previous meeting that we had, where I asked them to come together so they can have a representative that can have interaction with the Ministry of Education and the Ministry of Health and Wellness. It's a whole of a community approach where we are encouraging persons to assist us on this journey to health and wellness. If we don't take care of our children's wellness now, we're going to have to take care of their illness later. And that is something that we don't want. We don't want to take care of their illness. So let us do what we have to do now.
That is the consequence.
That is the consequence.
When we return, we're talking about the role of parents. Stay with us. Dr. Archer Bradshaw, a big component of this initiative working is parents being on board. What is the ministry doing to engage parents in this strategy?
Well, we've been engaging the NCPTA, so we've shared materials with them. We have had meetings with the parents to let them know about the school nutrition policy, let them know about the alternative snacks. Moving forward, we will continue to have sessions for parents, showing them how they can meal prep, showing them other types of options that they can have. Because sometimes parents think that they're limited to feeding their children certain foods that may be unhealthy. And they may say that it's expensive to try healthier options. But I know that the nutritionists at the National Nutrition Center will say, no, it isn't that expensive. These are some of the ways that you can prepare healthier meals for your children, and it's a lot less expensive than the meals that you're giving the children now. So we plan to have workshops for parents moving forward.
And I'm glad that you mentioned costs, because there's no denying that the cost of living is expensive. With families already struggling to make ends meet, what alternatives are on the table?
Krystal, I'm pleased to report that we've had help from the Barbados Childhood Obesity Prevention Coalition. Persons who are nutritionists, dietitians, and medical practitioners came together to identify alternative snacks and beverages. They ensured that certain factors came into play, and these factors are nutrient content, affordability, accessibility, availability, cost comparisons. They made sure that the snacks were age appropriate. They looked at the product type and processing level. And based on that, they were able to produce for us a list of alternative snacks and beverages, which you can find on the mes.gov.bb website. And these alternative snacks include pretzels, granola bars, digestive biscuits, local fruits such as golden apples, papaw, Bajan cherries. You could also purchase gala apples, grapes. I didn't mention the sugar apple, but that's very nice too. That's a local fruit. Plantain chips, lightly salted popcorn, lightly salted potato chips, lightly salted cassava chips. And in terms of nuts, parents could buy mixed nuts, raisin nuts, cashew nuts, trail mix or a mix, any kind of mix of nuts. The parents also have an option of a mixed fruit cup. And you can use local fruits or fruits that you purchase or a combination of both. But remember, the goal is for children to be healthy. In terms of beverages, we encourage plain water as a drink of choice, coconut water, 100% fruit juice or vegetable juice.
100% fruit juice without added sugars.
Without added sugars. So we're looking to reduce the sugar intake of our children.
Have adjustments been made to the meals offered by the school meals department?
Yes, certainly. We've made a number of adjustments. During the summer nutrition program last year, we introduced our first new meal. That was the pumpkin and sweet potato mac and cheese, and it was very well received. So now we have that as a standard dish in our school meals. We've also added the lentil stew. It incorporates vegetables such as squash, carrots, and peas. And it serves to educate our children about the concept of meatless dishes. And it provides an alternative source of protein. Processed meats such as hot dogs, bologna, etc. are currently not being used. Where hot dogs were once served, we've introduced now our country sub, which is made with chicken or tuna. And it uses the same hot dog bun, but it's built with lettuce and tomato or coleslaw and the dressing. We've also substituted our traditional beef burgers with locally made beef and breadfruit burgers from the BADMC. And these use breadfruit and cassava as binders as opposed to flour or chemical binders. Our menus also include a salad at least twice weekly, whether it be some version of tossed salad or coleslaw, and canned or fresh fruit that is served daily. And this pattern is only disrupted when there is unavailability. Cakes are seldom served. However, if there are locally made mix produced by BADMC, it is used. This product uses sweet potato and cassava flour as its base as opposed to white flour. And it also uses banana, apple, carrot, or some other fruit. Vegetable or flavoring is added. It must be noted that all of the meals on the school meals menu are approved by the National Nutrition Center, because we need to make sure that the meals are balanced. We have to appreciate that school meals sometimes are the only meals that children receive during the day. And we want to make sure that if that is the only meal, that is one that is balanced, is nutritious, and it's tasty. So the school meals department has done quite a lot of work in conforming to the National Nutrition Policy guidelines and in fulfilling the objective of having healthier students on plant. In addition to the changes made by the school meals department, I must commend the canteen concessionaires at our secondary schools. Many of them have made the transition to serving healthier options. They have removed fries, or what we call chips, that is fried in fat or oil, and they're now serving baked sweet potato chips or baked cassava chips or baked potato chips. They have incorporated vegetables, more vegetables in their meals. There was one vendor, one canteen concessionaire from a private school who indicated to me that some of the children are not eating the vegetables. And the principal got on board and made the suggestion that he could incorporate the vegetables into the meal by blending them so that children can identify what they are. And so far that has been working. But I commend the willingness of the canteen concessionaires to share their ideas at our canteen concessionaires and vendors meetings. Those meetings were exceedingly fruitful because while some of the canteen concessionaires were unable to see how they could make the transition, others in the same meeting were able to stand up and say, well, this is what you can do. This is what I have been doing, so you can do it too. So I'm very grateful for that kind of collaboration.
Beyond the nutrition policy, what else is being done to encourage our children to participate in more physical activity?
Physical education forms part of our curriculum. So throughout nursery, primary, and secondary school, our children are expected to engage in physical activity within the physical education program. What we want to do now is that we want to move this physical activity beyond the physical education program. We want children to get up and to be moving within the classroom, whether it be a chemistry class, biology class, grammar class, mathematics class. We want teachers to utilize strategies that allow movement while teaching the subject. Last year, around October, we also had some HYPE sessions, HYPE, which means Healthy Youth Through Physical Education. During that time, principals, teachers, and other staff, along with the students, engaged in dancercise. They had a half day dedicated to that movement. So the children dance, I understand that some of them utilize, there's a popular artist, or Spinny, right? And other popular artists, to engage in this kind of movement, because movement is indeed fun. And many of the principals and teachers are calling for more hype days. The Ministry of Education is encouraging that. Yes? So we're encouraging physical education within our schools.
What do you say to persons who suggest that the ministry should have implemented this policy in phases and it's perhaps rushed?
Krystal, I don't think that it is too rushed. Given what we are facing with regard to the non-communicable diseases in our youth or young people, there is no time better than now to implement. Change is hard. If you look at change, period, change is hard. Why take it in steps when you can do it one time? No, we don't expect perfection. What I expect is that all of the partners in education work together along with other ministries and agencies to bring about the change that is necessary. It will not be perfect, but at least let us strive for perfection.
And lastly, what would you say to parents?
I wish to encourage parents to support the school nutrition policy. In meetings with canteen concessionaires and vendors, concerns were expressed about parents who are putting pressure on them to sell their children unhealthy snacks. They said that some of them are not getting the support. So I would impress upon parents to give the canteen concessionaires and vendors the necessary support in terms of encouraging their children to purchase healthier options. It is not more expensive to eat healthily. That is a myth. And we can show you through our parent sessions, our parent training sessions, how that is not so. So I encourage them to come out. If they have questions, feel free to ask those questions via email to alternativedrinksandSnacks@gmail.com. That is through the Heart and Stroke Foundation. They have been a very good support for us. If they have questions, ask the questions there, but we need their help. And these kinds of behavioral changes, they should start at home. They should start at home and be reinforced in the school, not necessarily the other way around. But we recognize that some parents are not creating the food environment for their children or the activity environment for their children as they should. As a result, we have to do what we have to do in terms of ensuring that the children can grow up to carry Barbados forward.
Dr. Archer Bradshaw, thank you for making the time.
Thank you very much. My pleasure.
And thank you for joining us.